Wow, who would have thought 4 weeks in January would feel a lot more like 4 years? My name is Michael Abramson III. We have plenty to cover. Let's jump back in with another Alliance Advocacy update. Now, I know in our most recent video, I discussed how we had successfully passed a bill out of the House of Representatives that included an amazing increase in funding for community health centers and our priorities, and how that bill is now on its way to the Senate. However, our bill was part of what is called a minibus, or a collection of bills that are tied together and voted and passed all at the same time. One of the bills that our funding was tied to also included ongoing funding for DHS. And because of the chaos that we've seen over the past several days, we are now headed towards another potential government shutdown, as many senators are hesitant to provide any funding towards the Department of Homeland Security. This situation will continue to evolve over the coming days, and we'll make sure to keep you informed on both our funding priorities and how community health centers can continue to navigate through another potential government shutdown. Now, back here in Phoenix at our state capitol, one of the big conversations this week was surrounding the Rural Health Transformation Fund. For those that may not know, the Rural Health Transformation Fund was a part of the One Big Beautiful Bill Act that passed last summer that allocated around $50 billion specifically towards rural health initiatives, and each of our 50 states had to submit an application in order to be able to receive those dollars. Some of our state representatives and state senators feel like they did not have the proper opportunity to provide input during the stakeholder process that developed and eventually turned into Arizona's application for the Rural Health Transformation Fund. So this week, we have now seen mirror bills pass out of both the House and Senate Health and Human Services committees that will require the governor's office to go through an additional stakeholder process before they're able to allocate any of those dollars. Now, it is unlikely that the governor would pass that bill, but it is the state legislators voicing their frustration on how the process went originally. This week, we were also happy to see a SB 1169 pass out of the Senate Health and Human Services Committee. Now, this bill would allocate additional dollars to graduate medical education programs to help strengthen our healthcare workforce. We want to say thanks to Senator Warner for sponsoring that legislation and understanding the importance of our GME programs. That's all I have for this week. As always, feel free to email us at advocacy@aachc.org with any questions, and until next time.